In this podcast episode, Dr. Bret Contreras joins the podcast to unravel the science and practicalities of resistance training aimed at strength, hypertrophy, and aesthetics. With over 30 years of experience and a doctorate in sports science, Contreras emphasized how foundational resistance training is for both immediate and long-term health. The discussion began with addressing the frequency and volume that best serve beginners and experienced trainees alike. Contreras highlighted that hitting each muscle group twice per week is generally optimal for hypertrophy, balancing gains and recovery effectively. Although one full body session per week can yield results, the intensity required often makes it unrealistic without coaching and careful programming. He explained that progressive overload, the consistent increase of mechanical tension on muscles over time, is the cornerstone of muscle growth. This principle holds true across statistical variables like sets, reps, and frequencies. Importantly, the first hard set in a workout provides most of the stimulus for adaptation, so most muscles don't require excessive sets to grow. Contreras encouraged logging weight, reps, and effort meticulously to ensure consistent progression rather than mindlessly repeating routines. For most clients, 2 to 3 full-body workouts per week, or split upper-lower frequency formats, provide an excellent blend of recovery and growth potential. A distinctive contribution from Contreras involves his rule of thirds concept for training glutes and, by extension, other muscle groups. Contrary to conventional training that focuses predominantly on vertical loading movements, such as squats and deadlifts, Contreras argued for incorporating exercises that load muscles horizontally and laterally. The vertical plane involves squat, hinge, and lunge movements, powerful but demanding and highly stressful on joints. Horizontal plane exercises like hip thrusts and bridges emphasize muscle contractions in the shortened or squeeze position, allowing higher volume with less soreness. Lateral and rotational movements target hip abduction and external rotation, often overlooked yet crucial for balanced glute development. By diversifying exercise selection across these planes, trainees can increase their total recoverable volume and prevent overtraining while ensuring well-rounded muscle development. This approach also allows frequent training of target muscles without excessive strain. For instance, integrating gentle abduction exercises after tougher squats maintains muscle activation while allowing recovery. Contreras stressed that shifting the priority monthly or in cycles between different movement patterns enables athletes to push personal records selectively without overuse injuries or burnout. Glutes serve 3 major biomechanical roles: hip extension, abduction, and external rotation, all crucial for movement efficiency, injury prevention, and aesthetics. Dr. Contreras articulated that while traditional lifting like squats and deadlifts primarily target hip extension, many trainees benefit greatly by expanding glute training to include abduction and rotational exercises. This comprehensive targeting better addresses the complex functions of the glutes, improves movement quality, and optimizes hypertrophic response. Among common pitfalls, Contreras highlighted poor form and an inadequate range of motion when performing hip thrusts. Many lifters fail to fully extend hips at the top, limiting glute activation and growth. Proper bar placement, especially when using barbells, is critical to avoid discomfort and maximize effectiveness. Moreover, the typical knee and foot positioning in hip thrusts modulates muscle emphasis. Feet too far or too close can shift the load to hamstrings or quads, altering the glute stimulus. For maximal results, trainees need to maintain attentive form, control throughout reps, and progressively increase load while prioritizing quality over quantity. A recurring theme was the necessity of prioritizing training volume and effort toward weaker or lagging muscle groups while reducing the load on already well-developed muscles. Contreras explained that it's quite easy for trainees to maintain size and strength in strong muscles with minimal volume, sometimes as low as 1/3 or even 1/9 of the training volume that initially built them. This underscores the concept of maintenance versus growth. Once developed, muscles need comparatively less stimulus to avoid atrophy. Specialization phases lasting 4 to 6 weeks allow increased frequency, volume, and intensity for lagging muscles to catch up without overtraining the rest of the body. This focused approach also keeps training fresh and engaging, reducing burnout and risk of injury. Importantly, total weekly volume must balance gains and recovery. Blasting every muscle with high volume continuously is unsustainable. Instead, athletes benefit from cycling emphasis, allowing weaker areas to flourish while preserving the rest of their physique. Contreras reviewed the scientific consensus that hypertrophy can be achieved across a wide range of repetitions, from roughly 6 to 30%, provided the muscle reaches sufficient fatigue. Whereas older dogma favored moderate reps, 8 to 12, exclusively, more recent studies demonstrate effective muscle growth from both low-load, high-rep, and high-load, low-rep protocols. However, high-rep schemes may lead to more muscle damage and soreness, which can limit training frequency. A nuanced element of their conversation centered on training intensity and the utility of going to or near failure. Contreras favors focused hard sets, where trainees maximize effort, particularly in final reps, ensuring that sets are challenging but not necessarily all out in every set. Leaving 1 or 2 reps in the tank on some sets and compensating with additional volume can yield comparable hypertrophy. Such autoregulation supports adherence and longevity. Importantly, controlling form and movement tempo, without obsessing over it, helps minimize injury risks while providing quality stimulus. The calves stand out among muscles for their variable genetic potential and stubbornness to hypertrophy in many trainees. Contreras discussed the superior responsiveness of calves to stretch-based loading, endorsing standing calf raises, focusing on emphasizing the musculature in its lengthened position. Lengthened partial reps, focusing on the bottom half of the range, may provide additional benefit, especially after fatigued full-range sets to enhance total time under tension. In contrast, seated calf raises, which generally load the soleus muscle in a shortened position, tend to be less effective for hypertrophy, according to emerging research. Calf asymmetries due to injury or developmental discrepancies require individualized attention to volume and activation. Contreras corroborated how successful calf hypertrophy often demands a thoughtful combination of full and partial range training alongside recovery-sensitive programming, aiming to minimize pain and encourage steady progress over time. The podcast addressed important concerns about age and muscle growth, especially since many listeners are either middle-aged or older adults. Contrary to common misconceptions, muscle hypertrophy remains very much possible well beyond 40 and even up to 80 or 90 years of age when training is initiated properly. While the rate of gains might be slowed and total potential somewhat diminished due to factors like hormonal decline and satellite cell function alterations, the capacity to induce meaningful increases in strength and muscle size persists through late adulthood. Women undergoing menopause can expect to benefit from strength training similarly, though nuanced changes, such as fluctuating hormone levels and joint considerations, require careful exercise and load selection. Continuing to lift weights during pregnancy was also discussed as safe and beneficial for experienced lifters, with second and early third trimesters often being the most conducive for maintained training, provided adaptations are made for comfort and safety. A critical practical insight from Contreras was the centrality of enjoyment, motivation, and sustainable recovery in long-term training adherence. He contrasted programs that maximize short-term hypertrophy through ambitious volume and frequency with those optimized for consistency over years or decades. Many trainees fizzle out from programs demanding 5 to 6 gym sessions a week, while moderate approaches targeting 2 to 3 weekly sessions strike a balance between stimulus and life demands. Contreras acknowledged the role of genetics in recovery capacity and exercise enjoyment, illustrating that personalized adjustments are necessary. Emphasizing psychological readiness, for example, training when motivated rather than out of obligation, can prevent injury, decrease burnout, and facilitate neuromuscular improvements that compound into improved muscle growth. Listening to the body, auto-regulating session difficulty, and taking strategic breaks or deloads as needed form the backbone of long-term success. Injuries and nagging pains inevitably affect many trainees, and improper management can derail gains. Contreras highlighted the importance of proactively modifying exercise selection and weekly volume to accommodate chronic issues. For instance, substituting hip thrusts or step-ups when deadlifts or squats provoke low back or knee pain can maintain progress while encouraging recovery. Periods of reduced training volume or complete short layoffs, ranging from a few days to a full week, have been shown to prevent overtraining and promote better long-term adaptations without noticeable loss of muscle or strength. The conversation emphasized that progressive overload should not come at the expense of joint health or bodily function, as pain inhibits full muscle recruitment. Trainees need to embrace flexibility in programming, including switching exercise variants, reducing volume, and shortening sessions to optimize recovery and maintain enthusiasm. For individuals, particularly many women, seeking bigger glutes without proportional leg hypertrophy, Contreras offered thoughtful guidance. Most effective glute exercises tend to also work the quadriceps, hamstrings, and adductors, complicating efforts to isolate the buttocks. However, scientific evidence supports that glute-focused hip thrusts, back extensions, cable kickbacks, and abduction work can grow the glutes independently and comparatively effectively relative to compound leg-dominant movements. This approach facilitates increased glute volume with less quadriceps or hamstring hypertrophy, as these isolated or horizontally loaded exercises do not stress large leg muscles to the same extent. Contreras urged practitioners to experiment, but reminded that fat distribution and body composition also heavily influence aesthetics. Many concerns about leg size diminish with proper fat loss, wherein lean muscle tissue becomes more defined. One of the most striking recommendations Contreras shared was the effectiveness of minimalist training, particularly one set to failure per exercise 2 full-body sessions per week, for gaining the majority of potential strength and hypertrophy benefits. This approach is seldom practiced today, but offers an extremely time-efficient way to push muscles to near maximal fatigue and trigger adaptation. Although perceived as simplistic, this method requires mastery of effort management and regular variation of exercises to avoid plateau and injury. Contreras emphasized its psychological advantages. It reduces mental and physical fatigue from lengthy sessions while maintaining consistent progress. For many, such strategic low-volume training can increase gym adherence and generate durable results without extensive gym time.